Hello, everyone. Wish you a very happy Valentine's Day from Endo Crusaders. Dr. Vimi and I really want to wish you all a lovely, lovely Valentine's Day. Have a love-filled life. So imagine you have planned a romantic evening with your partner, and everything is going well, but you just can't seem to relax because one wrong move might put you in pain so severe that it lingers for days. Second instance, you've planned a fun evening with your friends or your family, and hold on, you just get an endo flare up. So, this is a very familiar scenario of some 176 million women worldwide who have endometriosis. With this condition, tissue similar to the lining of the uterus grows in other parts of the body, like pelvis, abdomen, and anywhere else in the body. So, this Valentine's, we would want to talk more about how this particular disease affects relationships, social life, and the day to day life of a patient suffering with endometriosis. So, Vimi and I have been doing these sessions to create awareness about endometriosis, which is a very, very common disease, yet very less researched, and people don't talk about it. But here we are to talk about this condition, which, as I said, affects millions of women. So, hi, Vimi.
Hi Shilpa, hi viewers. Wish you all a very happy Valentine's Day. And Shilpa, as you rightly said, this disease is least talked about. And it's a whole body disease. It's just not a reproductive organ disease, it's a whole body disease. And everything it affects. That's why we wanted to discuss how it affects relationships, how it affects your emotional status and mental health, and how it takes a toll on your lives. So we want all those women who are suffering from endometriosis, they should get their life back.
Absolutely, absolutely.
We can,
First of all, sorry.
if we can be any help, we would be
Absolutely.
very happy to help you.
More than happy to help, actually. And first of all, I would like to say a big sorry because we got caught up in an emergency and we got delayed for starting the session today. But, anyways, happy to be back again. And let's start the session. The first and foremost thing which I would want Vimi to tell our viewers is, does endometriosis affect day-to-day life of a patient, of a woman suffering with endometriosis?
Shilpa, as we know endometriosis, you have already told that tissue similar to the lining of uterus gets implanted outside and it affects the mostly reproductive organs, but it can affect any part of the body. And most of the patients have painful periods or pain throughout the cycle. And along with that, they may have several symptoms such as fatigue, depression, painful urination, painful defecation, painful intercourse, and many more symptoms. It's kind of iceberg phenomena. What we see is much more than that.
Correct.
So because of all these symptoms, a woman faces a lot of problems in her day-to-day life. It can have a considerable impact on her day-to-day life, her work life, child caring, everyday tasks, and social lives. This also creates extra strain on the couples. This has an impact on her working life, which ultimately leads to financial and emotional strain as well. It affects social lives, which we are going to take that topic in detail. And also, they feel restricted and they have a feeling of a sense of loss, which can affect both the partners and any relationships. They feel isolated, they feel unaddressed, and sometimes they can't express that what they are going through, or the people's around them don't understand, and then they don't want to talk about it, and then they keep on suffering for years together. So yes, it affects their day-to-day life, and ultimately it affects their relationships, financial status, emotional status, and their quality of life comes down.
Absolutely, like you rightly said, it's a complete it takes a toll on your entire body, mind, and emotions. And it's not easy to deal with it when first and foremost is you don't look sick. That is the biggest thing. A lot of diseases manifest on the outer surface, but here with endometriosis, whatever is happening inside is not manifested outside. So it's very difficult for a patient to explain it to the people around them what they are going through. So,
True.
uh, endometriosis does affect day to day life, but how does it affect couples who are in a relationship? Maybe a physical relationship or a emotional relationship.
Yeah, so Shilpa, it affects both actually, physical relationship as well as emotional relationship, and ultimately it affects families. As I said, most of these women who have painful periods, they may have painful intercourse that is called as dyspareunia. So they may have pain during or after sex, which is a very common symptom of endometriosis. And these women sometimes, because of this pain, they are scared to have sex and they avoid sex. That ultimately affects their relationship. This reduces intimacy and their relationship takes a toll. And pain is not the only factor. Sometimes they may have bleeding before or after intercourse. They have general fatigue. They feel sick or they feel tired all day. They feel unwell. They have also, some women complain of reduced sexual desire. They don't want to have intercourse, maybe because of the pain or the effects which this disease causes on their overall health. they, there is also a sense of loss of confidence in the body. They start thinking somewhere that their body does not help them or they cannot carry it forward. And definitely they suffer with low mood. And some women, those who are going through a phase of infertility, like they're trying to get conceived and they're not able to conceive, that also plays a very important role here. And they have a feeling of guilt and sadness. They start feeling guilty that there is some fault with them. That's the reason they're not able to conceive, they are not able to have intercourse, and they start finding fault with them. This again leads to a chronic state of vicious cycle where it takes a toll on their mental health.
Correct.
We have feelings of sadness, closeness, and affection. And women also face a difficult choice between avoiding sex or having a painful sex just to carry on with the relationships. Because we don't understand each person's relationship. Sometimes they do it just for the sake of relationship, be it very painful. So understanding each one's problem is very very difficult. It is the person who is going through only can understand. But these are the things which endometriosis patients go through, and it's very difficult to address. My heart goes out to them actually.
Absolutely, absolutely. Because a lot of times I think the physical intimacy is something which is so painful, but the fear of losing the relationship is even more. So it's a very stressful situation for such women, and it's like they need help. They really need help, and they need to talk about it. They need to come out and talk to their partners about it. So
Yes, communication is very important.
absolutely, absolutely. So there has to be a communication. Only then there will be. There are different ways in which this can be handled. So when we physical problems aside, what are the kind of emotional problems such women face?
These women and endometriosis patients in general, they go through a lot of emotional trauma actually. Sometimes, as you said, communication is the key, but uh, the partner or the family members or the social relationships they have, they may not be very understanding all the time.
Absolutely.
So they go through a lot of emotional trauma. And ultimately, if you have an emotional trauma, it affects everything. It affects your performance, it affects your quality of life. Whatever qualities or whatever talents you have, you can't express them, you can't do justice to your work. Everything gets affected ultimately. So a lot of emotional stress and dealing with these relationships become very difficult. But
True.
when they have true support and family where they have a good partner, good relationships, these women really can do well and they can bring the best out in them. So this is very important aspect of it, the emotional trauma they go through, because all this stress, feeling guilty, not having intercourse, not dealing with other relationships. It's not about partner relationships. It's also relationship with your friends, with your family members, and if they have children, taking care of their children and their demands becomes very difficult for these women to carry out. So this definitely takes a toll on their emotional health, and they need a proper counseling where they can have the schedule some sessions and have a proper counseling and proper support system. Here, family role comes foremost, and it's very important that they have a supporting family. And also, the patients, endometriosis patients, should they should not think that people will read their mind. They should be able to express themselves.
Correct.
If somebody understands them, they should be able to express so that other person can understand. It's not always that they will be understanding, because everybody, even the endometriosis patient, don't know what they go through. So
True.
how you can expect others to know that you will be knowing everything? So it's very difficult, and expression and communication has to be there so that the persons around you can understand it better.
True. That's right. That's right. So even when it goes to friends, I mean, for example, friends or family, you do, I mean, with endometriosis, you need to talk to your family or your friends about what the situation is. And there is a possibility of a flare up anytime. Being an endometriosis patient myself, I understand what it is. Maybe one moment I'm like perfectly good and happy. And the
Mm.
next moment, I would come into a phase where I really don't want to do anything because I'm in pain. Or maybe I'm
Yes.
not feeling good. So all that you need is you need to communicate that to your family, your friends, that there might be changes in the plans which may happen more often than not. So you just have to talk to them because most of the people would understand. They're not God. They would not be able to understand if you don't tell them. So
So
try.
they also should understand they are also going through some phase.
Correct.
They are
Correct.
not able to understand your problem.
Correct. That's true. That's true. That's what. So communication, what I feel is the core, is the crux of the entire thing. If you communicate well to your family or your friends, things would be much easier for you. I mean, even for your family, not just for you, because if you are going through a situation, your family is also going through a situation, right? Even they are trying to cope up with this disease with you. Your friends are also trying to, cope up with this kind of a situation that they are into right now. Okay, it's something new for them also. So I think just talk it out and figure out it should work. So
It's easier said than done,
I
because I
know, I
see,
know.
yeah, I see a lot of patients where their family members are absolutely not receptive to the idea that she's
Absolutely.
having some problem.
Understandable. That's very true. But I think there is a very high possibility, maybe at least, if not 100%, there will
Yeah,
be
they
at
should
least 40% who would
try.
understand. 40% people will not understand. That's that genre of people who would not understand anything. And you cannot do anything about it then.
Yeah.
So all you have to do is you have to try to work towards yourself than anything else then.
There are patients like they are talking to me regarding endometriosis. I'm explaining everything, taking time, everything. At the end, husband says, "What is this? Why did she get it?" After explaining everything, after telling them everything, they are not bothered why she got it.
I
Did
know.
she have it before marriage? Did she not conceiving because of this? Is it her fault? So there are a set of people where they might make
And
these
it's very
patients'
painful. And it's very, very
life it negatively impacts their quality of life again.
it's extremely painful when your family doesn't understand. It's very, very painful because that's where you look for support. And if you don't
Yes.
get support from your family, I think it is extremely difficult for that woman. I mean, it breaks me completely when I even think about it. So What social issues do women face? I mean, their physical problems, emotional problems. What is the social effect that you see generally? I mean, the social issues that women face with endometriosis.
If we consider our country, especially in India, once you are married or in a relationship, childbearing is the most important part. If you can't bear a child, you are good for nothing. That is
Absolutely.
what the families think.
Hmm.
And they think that a woman has to bear a child by at any cost. Whatever she is going through is none of their business. So this is the most important part, because most of these women, like 50 to 60% women, have subfertility or infertility because of endometriosis, and they might need some treatment or surgery, or ultimately IVF also. So
Correct.
they do go through a lot of family pressure, the pressure from in-laws, the pressure from their parents' family, and if somebody else is in the family who got married later and already has a child, that's the biggest thing for them to face, like
True.
why she is not getting pregnant. So that is one of the most important social aspect, where childbearing is expected from a woman, and because of endometriosis, maybe she's delayed with conceiving or not able to conceive. So there is a lot of pressure, which ultimately leads to emotional stress and fear of loss of relationship, and she becomes sad. The other aspect of is, many times when the family is not understanding, this also leads to divorces,
Correct.
the separation, mm, broken marriages, and other relationship gets affected. They might lose their friends, other family members, because the girl goes through a lot of pain, and because of all these factors, she is not able to maintain the other relationships also,
Correct.
and actually affects the work life. Even relationship with her colleagues may not be so good. So ultimately, it affects all aspects of social life.
True.
So that is the problem which women go through.
Hmm.
And major issue is, as I'm talking in terms of Indian families, as I said, childbearing first, and second is the divorces, the separation or the broken marriages. This is the major,
Correct.
major issue which these women are going through.
That's true. And
And
emotionally, it's traumatic.
if a young girl gets endometriosis, an unmarried young girl gets endometriosis. Now, the main concern the parents come to us is how she will get married. Arey, first you should be concerned about that girl. She's going through a lot. She has endometriosis. Let's sort it out. We do give them an option of egg freezing and other options so that her future fertility is secure. But their main concern gets how she'll get married. So our mindset needs to change. How we can help these patients of endometriosis in the long run. If our mindset changes, or our thinking changes, or our social criteria change, maybe we can have a better management for this disease for endometriosis patients.
True. That makes sense actually. It's all about the mindset. I think the mindset of people has to change. Only then the life of women with endometriosis, or girls for that matter with endometriosis, young girls, would change. Else it is a very, very tough journey. It's a very long journey. Because endometriosis is not curable, but it can be managed. So management is something which is very important. And all of us together can do it, and it's very difficult if you don't have that support system which is strong. So does not having support system, first and foremost. Secondly, the disease per se, does it take a toll on the mental health?
So all these are interrelated, Dr. Shilpa. So once your relationships are affected, or you're not able to conceive, you are emotionally stressed. So, if you're not doing a job, or you are financially stressed, ultimately it leads to your mental health.
Correct.
So many women, there are several studies also where a good percentage of women have committed once or twice suicide as well because of this pain.
Correct.
And some percentage of these women are committing these suicides because of pain, and some are because of the loss of relationships. They're not able to take that emotional stress. So these women face a lot of problems with mood swings, depression, suicidal tendencies. Because of pain, like I tell you, if I see 10 patients with painful periods, two patients tell me the pain during periods, they on the first day they feel like committing a suicide. They don't do it, they don't attempt it, but the pain is so severe. They utter this word in my outpatient department, and then really it should be addressed. So this is not in their hands. They can't really can't help it. Now, when they have painful intercourse, it affects their marital relationships. Now, especially in Indian families, when they don't have support from the parents' family also, and the husband says that I want a separation, then these girls again get a tendency of feelings of loneliness and sadness, and then they might lead to some uh, depression and sometimes suicidal tendency in those cases as well. So this is affecting them, their mental health a lot. Their counseling is very very important, because I will tell you 40% of our patients families are not very understanding.
Correct.
Husbands are not very understanding. Even if we tell them, counsel them, disease can happen to anyone. Even males have some diseases, females have some diseases. Endometriosis is a disease which affects mostly women, but uh, she has not caused it. It has some genetic association, and it has happened. How we can deal with it, it's more important. But you really need understanding people to do that.
That's true. Absolutely. What you said is like
We
absolutely.
need to be blessed to have that kind of a support system.
That's what I'm saying. I mean, I think for me, I think I've been so fortunate to have had a family who's been like a pillar of strength for me. Because every time I go through a low phase, it's my family which actually brings me up, be it my husband, my sister, my parents, my in-laws, whosoever. I mean, for them, I was more important. It was not about I not having a baby or having a baby,
Yes.
or I going through some kind of a social pressure. Probably my social pressures were taken off by them. They made sure that I was in a safe space. So as such, you are going through more than enough, more than what you can tolerate. And if your family is not supportive, it's something which is not right. It's not
Yeah.
right for the girl. It's not right for
Nobody's
the.
fault.
Absolutely. I mean, I think people need to understand. People need to understand. For husbands, probably I would like to say, if you would have a certain disease, I'm sure 99% of wives would stand by their husbands, taking care of them. So
Absolutely.
I think now it's their turn. If some woman is going through the problem, if the wife is going through a problem, I think you should. You should feel that for her. It's not just about saying, it's time you should do it. So with me, my next question comes about partner. So how can a partner of a patient with endometriosis help?
So basically, when we talk about relationship, so in these cases, both partners may experience a wide range of emotions. The women with endometriosis may experience feelings of frustration, guilt, low mood, irritability. The partners may experience helplessness and frustration, because
Correct.
sometimes they really feel helpless. What to do? He or she doesn't understand what's going on. All couples need to work to support one another. Some couples may find there is a mismatch between the support one partner needs, but maybe the partner is trying to provide the support.
Correct.
So this is something which is very difficult to address. But yes, at least talking about it helps. Now, it is unusual for partners to be asked how living alongside someone with this condition impacts them. So it is very difficult for someone who is not having the disease to answer this question. But yes, we have to also look at the other aspect. that suppose a patient of endometriosis, how her husband feels, maybe he's very understanding that what he goes through, that also is very important. We cannot ignore that part. We have been discussing that family has to be supporting, husband has to be supporting, everything is fine. But once they come to know that this is a lifelong disease, she might need surgeries or sometimes multiple surgeries, multiple treatments. Even after treatment, she's not having relief and she's not able to bear children. So we have to look at the emotional and the stress part of that partner also.
True.
Definitely, the emotional quotient of female partner is more than the male partner, but that does not mean he does not go through all these
Absolutely.
feelings and mood changes. So we should look at that aspect also. Now, how can partners cope with this condition best? One is communication. So never expect your partner to read your mind. Go and tell your partner how you feel and what support you are expecting. Just talk to them. The worst come scenario, you will get a negative response, but at least try.
Correct.
You should also be kind to them, because as I said, they're also going through a lot. Maybe they're not understanding what it is, what this condition is, or see your pain. You can only understand. I'm not in your shoes. Although I deal with patients of this pain every day, I describe the pain which they go through, but still I don't know what you go through. So this is you who know. So the partner can never know that how much pain or how difficult it is. They can empathize with you. So you have to tell them practical solutions might help you, like changing the treatment, taking second opinions, changing your work patterns, changes in diet, some pelvic exercises do help. These solutions may not always help, but at least you can try how for the betterment of your present condition, and how you feel about the condition can be helpful in relationships. You also should be open to find a balance of both styles of coping, like practical and emotional, and recognize where there isn't a cure or an easy solution. Again, how you think and feel about the condition can be very effective.
Correct.
You should always acknowledge and address the ways the condition affects you and your partner both. It's not only you are affected, because your partner is equally affected indirectly. You should acknowledge his state of mind as well.
True.
So, also, you should recognize that while communicating clearly and openly is the most helpful approach, but this is not easy for some people. So try to be supportive and encouraging if your partner finds it difficult to share their emotions. Some patients may not express it, so the other partner should be supportive to them. Uh, like I myself I'm very bad at expressing emotions. So
Absolutely.
I may not say, but yes, I may become uh, like I may not talk. I may feel low. So I think the other partner should start understanding that. And some people are not expressive. Communication is the key, but some people can't talk about it.
True.
They may cry, they may feel low, they may not talk for some time, they may feel like sitting alone. So these are the indicators where a partner can be very supportive. Now, even for painful intercourse, if you have difficult intercourse, but importance of continuing to show intimacy is there, like a human touch is important. Hug, kissing, holding each other, that really helps. So it's not always about having intercourse or sex, but these touch and hugs and kisses and all develops intimacy, and your communication can be better. So these are the things, if the partners work together and develop a support system within themselves, maybe they can have a better quality of life, and they can manage it in a better way.
Absolutely. That makes sense. So, for me, what I understand about how you can support somebody with endometriosis, like, for example, if since I have been going through it. So there are these pointers which I had made. One is listen when a person is saying something. Be a good listener. I mean, we find less people who listen to us rather than, there are people who would be open to giving opinions, but listen. Be understanding. There are possibilities, like I just said, that cancellation of plans would happen. So just you know be understanding about that. Understand that just because I would not complain doesn't mean that I'm not struggling. Like Vimi just said, a lot of us don't express as well. A lot of us probably have a very high pain threshold, so we bear. Doesn't mean that we're not going through it. Just find small little things like a hot water bottle, or a gentle hug, or a touch on your head, or just to say that, okay, fine, I know what you're going through, I understand you, is something which is needed. Respect when your partner is silent. Maybe there is a maybe you're in a stage where you just don't want to talk about anything. So these are certain things, and just find out what they need. Maybe the smallest thing is something which would just make their day. These are small little things which might just help somebody going through endometriosis. As a partner, these are certain things which you should be doing, which will help your wife or partner go through a easier life. So I think the session was important with me. I think we were planning on doing this for a while, and Valentine's Day was a good time to do this.
This is a very important aspect of this disease, actually. So we should look endometriosis as a whole, not just from the surgical aspect of it.
Correct. That's true. So endometriosis can make you very anxious. You might have depressions, mental health issues. So a research says that chronic pain causes negative cycle that can make other issues like anxiety and depression worse. It's like a vicious cycle. So, given the chronic nature of endometriosis, the potential impact on fertility and intimate relationships, the delay in diagnosis, and the problematic experiences that a person goes through, because with respect to social, psychological impact, are like significant. Third, what I also feel is the treatment costs are so high that it also starts playing on the mind, because financially it gets very, very taxing. So that is another aspect which I think also troubles a lot of people. So what I would again suggest is invest in a good health insurance. That is something which will help you in a long run. Because I think endometriosis, no one can predict how it goes. There, if you are lucky, you might not have to go for multiple surgeries, but if you are not that lucky, there is a possibility of multiple surgeries. So financially, you have to, make sure that you're in a position where you're able to afford those surgeries. So endometriosis is consider a considerable importance of both directly impacting your life emotionally, physically, and mentally. So it's a overall disease. So you need to take care of all the aspects. So it was a good session. I'm so happy that we did this. Are there any comments or any questions?
There are no questions. What we were discussing, that only they are mentioned. Fear of
Perfect.
losing relationships,
Yeah,
nobody
yeah, yeah,
knows
true,
how we can share. Same
true.
what we have tried to address. What,
Absolutely,
what
absolutely.
if the family is not supportive?
Yeah. So I think we have answered all of them. We have covered them in the session. So great. I hope this session was helpful. No, I love doing this session, and I hope this was something which all of you would have loved. Vimi, this was so amazing. A lot of people have been going through these issues, and this needed to be talked about.
Yes, Shilpa, definitely. You are correct. So
So
this is sometimes when patients come and we talk about their young girls come when I discuss about their future fertility and all, they get amazed like why you are talking about it. I said because I look at the disease, how you will be going through in the later years.
correct.
So I have to give you all the options. After 5 years, 10 years, you should not come back to me and say, Doctor, you never mentioned about all these aspects of the disease. And
Absolutely.
even know that it can cause this.
Correct. Correct. That's right.
This is very important. We should look at the disease as a whole and not only one time surgical treatment or some uh, medical treatment you have taken and then you're done for life.
True. That's right. That's right. So thank you everyone who joined us live, and thanks to everyone who are going to watch it later as a recorded version. And we will be back again with yet another topic. And in case you have something that's there in your mind, in case there's something that you want us to talk about, do drop us a message. We would be happy to help you with that. All right, take care and have a lovely evening ahead. Bye bye.
Thank you.
Thank you.